So thanks for joining us. My name is Tiffany Garrison-Stanley. As he mentioned, I work at Blackhawk Technical College. And so today I'm giving the webinar from our Anatomy Learning Center, which features, it's kind of the core of the Anatomy Learning Center is the Anatomage table. And so I'm just going to go ahead and share my screen here and jump right into it. So today, what I'm going to talk about is how we've created some anatomical materials to support student success in health occupations here at Blackhawk Tech. And the Anatomage table has been an integral part of that endeavor, basically. So in today's presentation, I want to just give a brief overview of the Anatomy Learning Center, mainly how it's kind of set up and how the Anatomage table kind of acts as the hub of all of the activities. And then I'm going to actually go through a couple of examples of how the Anatomy Learning Center, specifically with the use of the Anatomage table, a couple of examples of resources that we've created for some very specific health occupation programs. So we'll go over a review that we've created for the dental hygienist program, go over how we conduct anatomy workshops for our surgical tech program. We actually created a GI workshop, so a gastrointestinal workshop for our radiography program, and that was actually given, we zoomed the table actually into the Wisconsin Association of Educators in Radiographic Technology. So we were able to actually utilize that workshop at a symposium for Wisconsin educators. We also created what we call FOMA. It stands for Focus on Musculoskeletal Anatomy. This is a review module that's created in Blackboard specifically for assistants in the physical therapist assistant program. Specifically, we wanted to make sure that students were really getting musculoskeletal anatomy. And so that was important to create that for them. And then at the end of this, I'm just going to go over some easy tools that we use on the Anatomage table. Okay, so hopefully this will give you some ideas on how to actually incorporate this into your curriculum and how to support maybe some programs outside of general education anatomy courses at your institution. Okay, so let me just share my screen again. So the first thing that I want to do is just kind of talk a little bit about the Anatomy Learning Center. This was an endeavor that we started about 3 years ago at Blackhawk Tech. We had an Anatomage table. So I started working here about four or 5 years ago. We had an Anatomage table, but it was kind of in a room. People had access to it, but nobody really knew how to use it. We had some training, but I think that it was really just, we were having a hard time kind of getting the incorporation of the Anatomage table jump-started at the college. So, we really could utilize this in general education. So we teach approximately 350 students per semester in just general anatomy and physiology. And so as an anatomy and physiology instructor, I saw absolutely we can use this technology. This is perfect for the labs that we create. This is perfect for the competencies of the course. So if we could have the table along with all of the models and all of the kind of traditional methods of teaching anatomy all in the same room, we could really have a really powerful learning environment. And so we created the Anatomy Learning Center, and you can see in this image here that we've got all the models in the room. We also have the table it kind of takes up one quadrant of the lab. And then we actually have the table set up so that it can be visually seen on the monitors on the wall. So you can have students standing around the table, and you can also be showing the table to the whole room. We have 6 instructors that work in kind of a flex lab environment in this Anatomy Learning Center, and all 6 instructors are what we refer to as Anatomage super users. So they completely understand the table, they're well trained in it, they know all of the cool tools and tricks that you can use on the table, and they not only instruct our general A&P students in the labs, so they're actually acting as the instructor, they also actually act as kind of instructional designers for some of the health occupation programs that we have on campus. So we actually have 16 health occupation programs, including nursing, nursing assistant, EMT. But in this presentation, I really wanted to show some resources that we made for 4 specific health occupation programs, specifically the dental hygienist program, the surgical tech program, radiography, and the physical therapist assistant program. And so this is just a video of the lab. I just kind of wanted to show a few things. So as you kind of walk into the lab, you can see that it's a really wide open space. And so we've got all of the models kind of right as you walk in, and it's actually kind of, again, it's really organized into quadrants. And so you have kind of a quadrant of the lab blocked off with these open shelves so people can kind of grab the models as they want to. It's very easy if we're working on the table, which is just on the other side of this shelf here, to grab a model as we see the need for it. And so this is actually a Zoom table where students can actually grab models off the shelf and Zoom with folks in a virtual environment. So if you have a student that can't come to campus but wants that group work, they can Zoom from that table. So I just wanted to kind of fast forward here and show. Okay, so in the back of the room, we actually have 2 large monitors. And those monitors are actually hooked up to Wacom tablets. So if you wanted to screenshot anything off of the table, say you had, a color-coded leg with muscles, so that you had each of the muscles color-coded a different way, you can screenshot that. And then you can we have students using OneDrive, so you could save it. And the Wacom monitors in the back actually allow them to electronically label things. We have students working in groups where maybe 2 students might be at the table doing screenshots to make their study guide, and then 2 students that they're working with are sitting at the Wacoms and labeling things or writing on the screenshots like, hey, remember this, things like that. So they're actually working in groups to create study guides. And then as far as the table is concerned, the table makes up one of the quadrants. Sorry. And the table actually is then hooked up to monitors that we have on the wall. And so anything that you've got going on the table, you also have being displayed on the wall. And then I'm actually standing in that area giving my webinar right now. So I'm using an ambient speaker and ambient mic, so I can move around in the lab, and my students can actually be zooming into the lab and actually speak with me when they need to talk to me. I can see the chat box. I can be in another area of the lab helping other students. And if I hear them speak, I can be like, just a second, I'll be right with you. It's a very, it's an environment that allows virtual students to experience kind of that group activity of being in the lab. Okay, so let's just kind of get into it a little bit. Okay, so some of the services that we provide from the ALC. So remember, we've got 6 instructors that are super users. So we're not only teaching general A&P students, we're also actually kind of integrated into the health occupation programs and the greater marketing activities from the college itself. So we're constantly giving tours to high schools, to prospective students, any student service event that's going on campus. We've got that going on in the ALC. We want them to come through the ALC. So we've got, STEM Day, and we've got Tech Exploration Day. These are all where we've got students coming in. They might be looking at, say, health occupations, particularly as an avenue for their career. So we would make sure to have them come through the lab. So it's kind of like a shiny new toy for the college as far as a marketing ploy. So we're also, in addition to giving, the marketing activities, we're also training program students and the faculty within those programs to use the lab equipment, including the Anatomage table. So there are some instructors who might be a little bit more hesitant. They'd rather you just kind of conduct the workshops. There are some instructors that are like, I want to use the table. I want to bring my students in here every day. So for those faculty, we would actually give them kind of a tutorial on how to use the basics of the table. We would set up some times when they could work with one of our super users to really get comfortable with the tools that they want. And then they kind of just go on their own and they kind of start to become their own super user. We are also the 6 super users within the ALC. We're also creating some asynchronous course materials for health occupation instruction. So it might just be like, hey, we'll create you a PowerPoint or a video or something that you can incorporate into your own lecture materials, your own course materials, where we don't have to physically be there conducting a workshop. It's just something that's like a standalone instructional material. And then we also prepare and facilitate face-to-face and Zoom workshops to support program instruction. So it may be something like, they want the students to actually come down here and utilize the table. So we would kind of, maybe create some presets or maybe create a PowerPoint that kind of guides them through something. We have just recently started getting into creating quizzes for specific program students on the table. So they can just kind of come down here and pull up the quiz and take the quiz over the anatomy that they're looking at. So I wanted to focus on a couple of the programs that we've supported over the last year. So the lab had launched actually in 2020. It was a little bit of a rough start because, as you know, we had a pandemic going on. And so really 2021 and now into 2022, we're really starting to see it being utilized really in kind of this health occupation support facet. So I just wanted to focus on a couple of the resources that we've created, starting with our dental hygienist program. The dental hygienist instructors came to us a couple of years ago and basically said, our students are not doing as good as we want them to on our certification exam. So once they're done with their program, they have to take a certification exam, which requires them to know not just the anatomy of the head and neck, but also kind of just generically what the other systems in the body do. And so we kind of sat down together, the dental hygienist instructors and 2 of the super users in the ALC, and they created kind of an outline of what they wanted to be covered in the workshop. And so we just created this outline here. Let's pull up the presentation while we're waiting on that. Okay, so the outline is really where we always start when we're building a resource for one of the health occupation programs. And we let those instructors dictate what needs to be covered. So this is something that the dental hygienist instructors came up with. They basically wanted to cover all of the bones and the muscles of the head and neck region. They also wanted to make sure that the students understood the vascular supply to the teeth. They wanted us to cover the salivary glands along with innervation of the mouth. And then at the very end, they did want us to cover the lymphatics of the head and neck as well. So this is something that basically we had the dental hygienists come up with, and then we built the resources around it. So one thing that we did very simply, has nothing to do with the Anatomage table, is that for the bones of the head, we put links into the review outline that links them to a Quizlet that actually goes over images of each of the bones in the head. And so that's something very simple that they could put into their Blackboard shell. Students then can study using the Quizlets that are embedded in the outline. This is kind of what we would consider kind of like an asynchronous study tool. Okay. In addition to that, we also created a PowerPoint. Getting too many things open here. We also created a PowerPoint, and this PowerPoint is actually used in conjunction with the students being in the ALC at the table. Okay, and so we go through like the body systems, we kind of give an overview of that, and they can actually bring up these systems on the cadaver and actually explore it in more of a three-dimensional way. So when we talk about the cardiovascular system, we'll actually show them how to use the visibility menu and pull up the cardiovascular system. When it gets into some of the more specifics about the bones of the head, the musculature, the vasculature, the innervation of the teeth, things like that, then we really start to utilize the benefit of the table. And so you'll notice here that on these slides, it says the high-res head and neck preset 1. We've actually created presets that go along with all of these images. So everywhere that you've got these preset notes in the PowerPoint, the instructors know that there are presets for that, for this PowerPoint that you can pull up on the table, and then you don't have to take the time to color code the bones and pull up the musculature that's specifically being talked about. So I just want to go ahead and stop sharing this and show you on the table. All right, so like I was mentioning, the dental review is basically set up so that we can actually have them look at the PowerPoint. That's kind of like the asynchronous version. So this would be kind of the asynchronous kind of version that they could put in their Blackboard shell. But then we would actually have it set up so that you could come in and do the presets on the table. And so if we do this, we've got, you would pull up the high res. Okay, you would pull up the high res image of the head and neck, and the presets then would be called out in the PowerPoint. So students could actually come in and they could pull up, the preset where we've only got the musculature for the head and neck. And they could, then they could work through it, and they could just utilize the table in a more three-dimensional way where they could take off layers if they wanted to. They could isolate things if they wanted to. You can take off superficial layers so that you can see some of the deeper muscles. You can actually see the attachment points of the muscles. So, students come in and they can very easily pull up these presets that are called out in the PowerPoint that they have available to them. Students particularly find vasculature and the nervous innervation of the teeth very helpful, because there's not really any other tool out there that allows you to kind of isolate this and color code and move it around in a three-dimensional way. And so the other thing that we're really careful about when we make these PowerPoints and we make these presets is that we want to make sure that we're using the same color scheme on the table as what they see in their PowerPoint. So if we, for instance, pull up this last image here of the innervation of the face and teeth, you can see that we've color coded the various portions of the nerves. And then if we look at the PowerPoint, then that is mimicked within the PowerPoint itself. So if we pull this image up, we use the same color scheme as we see in the PowerPoint so that students can identify, okay, this is what we're looking at. Of course, they can always touch screen the Anatomage table and they can see what those branches are. And so we do this for quite a few different programs where we kind of make these PowerPoints based on the outline that the instructor creates, and then we kind of mimic it in the three-dimensional environment of the Anatomage table. So another example is for our Surge Tech programs. we were really finding that students were going into our simulated surgical suite, just not really understanding, not really knowing the anatomy, or not really being comfortable with the anatomy. And so we worked with the surg tech instructors, and we came up with, okay, on this day, we're doing this surgical procedure. So 15 minutes prior to it, a half an hour prior to it, we're going to have students come down, actually stand at the table and work through the anatomy. So an example would be like on the carpal tunnel, we actually have the carpal tunnel presentation, and you'll see, this is basically what we're covering in it based on what the surg tech instructors wanted to do. And then on each of the slides where it's got, a picture of, for instance, the median nerve, you can also pull that up on the high-res forearm and hand. Specifically on the male, it's preset 2. And so we've got these preset files, and those preset files are always called out at the beginning. So you can see here, use the CTR anatomy review VPF on the high-res forearm of the hand and male. So it mimics basically what they're seeing in their PowerPoint. And we found that pretty much all of our health occupation programs are utilizing this asynchronous PowerPoint and outline in their Blackboard shell, along with the presets that we have set up on the table. The students then can come in on their own, and they can pull up that VPF preset and look at it in a 3-dimensional way. Right? And so in addition to that, we've also, like I mentioned, we actually conducted a Zoom table, a Zoom conference. We Zoomed the table into a conference for the Wisconsin Association of Educators in Radiologic Technology. At the symposium, they were talking a lot. Their kind of theme was the positioning of the cadaver. And so what we did is we created a bunch of presets that actually showed some of the landmarks. We color-coded the vertebral column. We pulled up the intestines. We pulled up the stomach. We pulled up the esophagus. And we could actually turn it and show that the positioning of the patient gives you different angles, gives you different views of the structures of the gastrointestinal tract. And so while they were teaching positioning, we were able to show a 3-dimensional cadaver and show how that positioning changes what you can view on the cadaver. And so that was really helpful. We actually had a couple of schools then come bring their radiography students to our campus after that symposium, so that we could actually experience the table with them in the ALC. Right. One last thing that I wanted to go over was a module that we created for the physical therapist assistant. So this was kind of our first endeavor into big project, and it's been tremendously successful. So we met with the physical therapist instructors, and they were basically saying, students aren't retaining from the time that they leave general A&P and they actually have to take their muscular and skeletal practicals to the time that they petition and actually get into the physical therapist assistant program. We are seeing that there's just simply not enough retention of the terminology. Additional to that, as a general A&P instructor, we were finding that of all of the assessments in our general A&P classes, our students struggled particularly with the muscular and the skeletal practicals. And I'm sure that we're not the only ones that see this. And so we actually created a Blackboard module that we affectionately refer to as FOMA, called Focus on Musculoskeletal Anatomy. And it's available to all general A&P students. It is an optional study resource for them, but we do kind of offer them a carrot, like they can, if they utilize it, they can earn 2% on their overall exam scores. But it actually is earning them petitioning points for the PTA program now. So if they complete it with a B or better, they can earn petitioning points. Preliminary data on this, and again, we've only been doing this for a year now, is that there's a substantial increase, upwards to 7% in the increase on the average score for the skeletal and muscle practicals. And so this is actually embedded into Blackboard. And we've utilized images from the table. and videos from the table. So for instance, if you go into the muscular system and you go into the muscles of mastication, the muscles of facial expression, all of these are videos that have been taken off the table where we're actually pulling up the list of muscles there and we're talking about how they would be involved in the movement of the neck. So instead of just having like a list of muscles saying like, this is the origin, this is the insertion, these are the attachment points, and this is the function of it, we kind of we work with them in groupings, and then of course that's all presets that we have collected over time in the table. And so some of the tools that we would use to do these. So if I can just share this screen here. So one tool that we find particularly helpful is kind of the visibility menu. The visibility menu obviously tells you what you can and can't see. And so here we have the skeletal system pulled up, but we also have the skeletal system transparent. And then we've got, and that's by clicking this button here. And then we've got the nervous system pulled up, specifically some of the branches of the maxillary nerve, cranial nerves, the different branches of the cranial nerves, and they're color coded. So you can see in these images here, in the visibility menu, you can see actually that there's a color wheel, and that's when you have some color coding going on there. So the visibility menu is huge. And we could add, for instance, we could add the muscular system to this. You can add different layers. You can choose which muscles you want. So maybe you just want the muscles of mastication. So you could add those. So visibility menu is huge on being able to narrow down what you're seeing. And then the other menu that we really find really helpful is the explore tool, which is the image of the woman with a question mark. There are two particular tools on this menu that we really enjoy. One is the vertebra that's missing is basically if you click that and you touch anything on the cadaver, it will disappear. So this is really good when we want to see, like depth layers of things. We can remove certain structures to show the structures beneath them. The other tool that we find particularly helpful is the what we call the isolation tool, which is the vertebra that's highlighted. If you click on that and then you touch anything on the cadaver, it will actually isolate it within that three-dimensional space. And so, if you're talking about structures in the digestive system, for instance, figuring out where the pancreas is always a difficult thing for students. You can isolate that structure and it kind of shows everything else in a transparent way, but you can see where it sits within the three-dimensional space of the body. So that in that explore tool, the isolation tool is particularly helpful, especially when you're talking about structures that sit in a space kind of behind other organs. And then we also use the screenshot tool. So if you click on the camera over here, you can see that you have various versions of screenshotting. And so the first one is basically everything on the table, including the menus. Second one is without menus. We generally use just the free cut, which is the third option with the scissors. And if you then just draw a box around anything on the table, it will screenshot that and you can save it either to the table, or what we generally do is we use like a little memory stick or zip drive and we save it to that. So we actually save our preset files, our VPF files, to this zip drive as well, and then we share that with the individual instructors. So we take screenshots to embed in our PowerPoints, and then for the presets, if you wanted this, for instance, to be a preset, you would just click on the 1, 2, 3, 4, click on the settings, and see here. So we've got 11, so we can add this as the 12th. And then if you wanted to export that, you would just highlight it and export the VPF. And again, you can save that to your zip drive. Or you can save it to the table. We generally have not saved a lot to the table. I'm not exactly sure why. I think it's probably because we've been kind of utilizing the OneDrive to share VPF files, things like that.